To improve the oral health of students with intellectual disabilities, it all relies on the carers to help them to establish a toothbrushing habit in the morning and at night. You should teach and guide them to brush in sequence, to brush every 2 teeth at a time, and to brush gently along the gum margins.
Try to brush 10 times here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Right. Now move to the 2 teeth in front.
Hello?
Miss Chan, what can I help you?
Brushing technique? I'm still new here. I want to learn more. Would you want to teach me?
Sure. Let me get the teaching material first.
Let me help you.
Thanks. Usually, how do you brush for them?
I stand in front of them. That's what I did.
Have you noticed that the heads are moving around when you brush for them? It's difficult for you to help them brush, isn't it?
Yes. What can I do then?
Stand behind them and look at the reflection in the mirror together. Your left hand will hold the chin to stabilize the head moving. Do you want to try?
Am I doing it right? But I can't see his mouth.
Have you noticed that your hand was blocking your and his view? Put down your hand a little bit so that both of you can see and he can learn how to brush.
I see.
You can also turn his head left, right, up, and down to give you a clear view.
That's good. So the saliva won't splash onto me too.
Yes, if I do that face to face, my big head will scare them. Since you're so friendly, it won't happen to you.
Mr. Wong, you must be kidding. My hand is moving the wrong way when I'm looking into the mirror.
Let me show you. In the beginning, it's difficult for you to brush his teeth by looking at the mirror image during brushing. You have to make sure that the room is bright enough before you put the toothbrush into his mouth. Hold the head and judge exactly where you brush in the mirror before inserting the toothbrush. You can then slide the toothbrush from the canine to the last molar along the gum margins before brushing. Only start brushing after you have put the toothbrush in the proper position. Do you want to try?
Is this correct?
Yes, not bad. Now try to move the toothbrush slightly to the front for the next 2 teeth.
Oh, once I move the toothbrush, I can place it correctly again.
In that case, you should take out the toothbrush and put it back by sliding from the canine to where you are aiming to brush. Right, that's it. You should hold near the end of the handle so that it's long enough for you to brush the last molar. Don't hold the toothbrush too tight. Loosen your fingers so you can move freely.
Is this okay?
Well done. When you are brushing for them, please don't forget to brush along the gum margins. Tilt the toothbrush towards the gum margins and brush 2 teeth at the same time. When you're brushing the lower teeth, the bristles should be tilted downwards. On the other hand, tilt the bristles upward when you're brushing the upper teeth.
Why do we only brush 2 teeth at one time? Why not more?
If you brush several teeth together, you may brush the teeth too vigorously. This may make our clients feel pain and become uncooperative.
Oh, I see. Okay, I will brush 2 by 2 and gently then.
Also, the drastic motion may cause the toothbrush to be out of position.
Oh, there are a lot of useful tips for toothbrushing. I'd like to know, some of our clients always open their mouth wide and close gradually afterwards. What should I do?
When they open their mouth wide, you should grab the chance, look and find out the position of the last molar. Then you put the toothbrush at the right place quickly and brush their teeth.
Oh, I see.
In fact, it's difficult for them to keep the mouth wide open for a long time. When I brush the outer tooth surfaces, I won't ask them to keep the mouth open because the cheek muscle will be tense and tight, leaving no space for the toothbrush to get in. The toothbrush may be pushed out of place. On the contrary, when they open the mouth just slightly, it's easy to put the toothbrush on the molars. Once I put the toothbrush in the proper position and brush with a scrubbing motion along the gum margins, I can clean all the teeth at the back.
Oh, I see.
When you brush the front teeth, nothing will block your view.
How about brushing the chewing surfaces? Should they open their mouth wide?
Yes, in such case, they should do that. After brushing for some time, let them rinse and rest. Then they may open the mouth wide again.
So, how about the sequence of toothbrushing?
I've learned the dandelion oral care action from the Department of Health. It breaks down the brushing sequence into 5 stages.
What are they then?
Stage 1 is the outer surfaces of the lower teeth. Stage 2 is the outer surfaces of the upper teeth. Stage 3 is the chewing surfaces of the lower teeth, followed by the chewing surfaces of the upper teeth. Stage 4 is the inner surfaces of the lower teeth. Lastly, Stage 5 is the inner surfaces of the upper teeth. You won't miss out any surfaces if you brush in order. Will it be easier for you to start from the left-hand side?
I normally hold the toothbrush with my right hand. It's much easier if I start from the left.
If you do not get used to brushing by looking into the mirror, try to train up your hand by holding the toothbrush head pointing towards yourself. Then you look at the mirror and hold the toothbrush to move back and forth. This can increase your sense of direction. When you're familiar with this motion, you can try to restrict your brushing stroke. Well done! Practice makes perfect. You can practice more on the model.
Mr. Wong, this is really useful. I would like to learn more when you practice on the real person.
Okay, I'll ask you to join us next time.
Thank you, Mr. Wong.
You're welcome. Would you like to practice again now?